A lot of patients ask me, is this going to hurt? And it's a question that I get most every day when I perform surgery. So when it comes to questions about pain related to surgical procedures, I try to be a little more straightforward about, hey, this might pinch or this might hurt for a little bit. But in general, especially for the patients who are awake during surgery, I like to say the numbing shot's gonna hurt a little bit, and then after that you shouldn't feel anything. And for most people that is usually the case. The idea is that we wanna make this as comfortable and safe a process as possible. And a big part of that is alleviating any anxiety around the pain that could happen during surgery. If somebody says, oh, I have a really low pain threshold, that alerts me to the idea that, hey, this person might need a little more TLC. Regardless of how much numbing medicine or other alleviating measures I might give, always at the beginning of surgery, we numb the area before we perform the surgery. So even when it comes to that first tiny poke that might hurt just a tiny bit, I tend to say, hey, tiny poke right here. And during the numbing process, I always say, hey, you're doing great, just nice, slow, deep breaths. So it's really about physically numbing so that you experience no pain or very, very minimal pain during surgery, but also helping the patient through the actual process of numbing and through the entire surgery. It's really a relationship process in terms of helping the patient go through their pain, not just actual physically, but also just mentally getting over that hump.